Good morning, everyone. Buenos dias, todo mundo, and welcome to the Cafecito Wednesday with the GRHCC. My name is Carmen Linus. I'm the current chair of the GRHCC. We started putting these Cafecito Wednesdays together to give you a variety of issues that are going on right now. First, we are going to have Paloma Montes representing Councilwoman Erin Edwards' office. We're going to have Laura Acosta from HC2 Strategies as our member spotlight. We are going to be providing you with COVID-19 legal updates, as well as providing you with our chamber and partner updates. So to get our webinar started, I would like to introduce Paloma Montes, who is the legislative field representative for Councilwoman Erin Edwards. Welcome, Paloma.
Good morning, everyone. It's good to be here. Thank you so much for having me/us, the Ward 1 office. Erin is disappointed and sad that she couldn't be here due to a conflicting meeting. However, she's looking forward to being here at a future time to spend with y'all. But her background is primarily in the nonprofit sector. She's ran soup kitchens, so she's got a lot of experience with that sort of work, primarily through AmeriCorps and United Way. So she brings that expertise onto council so that we can bring several goals into the office, being everyone is heard, that there is transparency, and to move mountains for the greatest good. So we do hold those things dear in our office, as well as now as we are in a pandemic, protecting public health. So that's a segue into our own updates from regarding COVID-19. Currently, we are in late stage 2 of the governor's 4 stages, meaning that as of last week, personal care industries were able to reopen. So that would be nail salons and salons of that sort. But the number of COVID cases continues to rise. Yesterday was the highest number of cases ever, which was 631 cases, excuse me. Our county is on a watch list as well. Due to increased hospitalizations, the state has a threshold for a 10% increase in hospitalized COVID patients. We are currently hovering near that threshold and might surpass it. We're facing a decrease in available ventilators as well. We know that many businesses could barely survive the first closing down of businesses. So we are working really hard and know that we must do everything possible to ensure that we can stop the spread of COVID-19. Sorry, I lost my spot, but we got to stop the spread of COVID-19 so that businesses that have been able to open don't have to face that fear again. Currently, mask wearing is mandatory in the state, and the city is working on a plan for a second wave. To support businesses, our office is helping with the small business micro grant that Councilmember Edwards co-authored with Council members Fierro and Hemingway. This is a partnership with the United Way, and this fund has $1.8 million in it, which means that we can give grants up to $7,500 each. It is for businesses with 5 employees or fewer, and they must be medium to low income business owners. This is done on a first come, first reviewed basis. And currently we've heard that there are 90 applicants that have met the criteria and are on the road to being approved, which is a really good piece of news. Though we might run out of funding in the next month. So please, if you do intend on getting your application in, do so quickly. That way you can get in line for that first come, first reviewed criteria, as well as making sure that everything in your application is filled in all the way. And I'm happy to answer any questions or pass along any questions to staff and get back to y'all. Just give me your contact information and I'll be glad to connect afterwards. We've also worked with city staff to change ordinances allowing restaurants to use more outdoor space. This has helped with physical distancing. And the way to go about that is through a tracking program that people can even implement themselves to see if they can qualify for a permit. But if you need more information about that, I'll be glad to give that as well. But again, that is based on a permit. So folks will need a permit to determine if they meet criteria in order to reopen. As far as other policy goes, like I said, one of our goals is addressing homelessness. Currently, there are 30 pallet shelters out near Hewlin Place, and they are all full. And there were 15 trailers installed at the Riverside Airport. Currently, all of them are full as well. We are participating as a city with the county on Project Broomkey, which helps around 500 people get housed across Riverside County in hotel rooms, and that was done with the state as well. And there are currently hygiene stations at the river bottom and at Massachusetts Avenue to help those that are without shelter still be able to wash their hands and keep clean, or as clean as possible. And the county has also approved $700,000 at their last meeting last Tuesday to work with the city along the river bottom, which although there are many issues that surround that particular area of our city, we know that that homelessness is an issue that is folded among those other issues. So this is pretty good news. At the meeting on June 16th, council approved hiring 2 nurses for a pilot street health team. And that's awesome. You know, that's 2 nurses that'll be helping folks that are homeless with medical needs, as well as the eviction moratorium, which was established in the beginning of the pandemic. We are mindful that when the eviction moratorium ends, we may see an increase of people who are unable to pay rent due to lasting COVID-19 impacts. So that is on our radar. In the future, we are aiming to meet the regional housing needs assessment, and Riverside needs to build 18,000 housing units. So our job will be to ensure that while this is a mix of market rate and affordable housing, that there is an emphasis on affordable housing. Councilmember Edwards is on the mayor's housing task force and chairs the council's homelessness and housing committee as well. And she is currently at a continuum of care meeting, which is the body that allocates funding across the county to address homelessness, which is why she can't be here today. Following that, our second pillar, which is investing in neighborhoods, we've done work to establish a moratorium on building warehouses on the north side of Riverside until the north side specific plan is completed. And that's been a process that residents in that neighborhood have been waiting on for years. So this is monumental for their neighborhood. The moratorium was for an initial 45 days and has been extended until the end of the year, which is by December. And the Northside specific plan will go before City Council for approval by the end of the year. We are trying to be thoughtful about the kind of development that builds a neighborhood. And an example of that is that the Northside doesn't have a grocery store. The residents are aware that even as we're bolstering housing in that area, that there are not many services to offer their neighborhood. So we are looking forward to making sure that there is access to simple things such as food in that neighborhood. We are working on passing stronger vehicle miles traveled thresholds. So we know that Nathan Mustafa was able to come to Cafecito Wednesday and present on that as well. And council did pass the threshold that is 15% better than our current threshold, which aligns us with the California Air Resources strategic goal and helps us in doing our part to actively improve the air quality in our region as well. And next, we want to see Riverside put on the map. This means that we're working hard to bring an agreement for the Cheech before council. And the third memorandum of understanding between RAM and the city is on the consent calendar for the July 7th city council meeting. The Festival of Lights is also in the afternoon discussion for July 7th. So be mindful of that. Because of COVID-19, there will be a scaled back event this year, but we are hopeful that we can be able to do something for the community still. That might look like a home for the holidays theme, which might bring people downtown who haven't been in the downtown area during this time in the past due to large crowds. So we'll try to highlight local businesses as we do that, if that is the theme. Other upcoming things for council would include the June 30th meeting, where the Human Relations Commission, City Council, and Police Review Commission will be discussing police policies. And on July 14th, there is an all-day City Council meeting that will begin the City Council's discussion of priorities, which will underpin the fiscal year 2022 priority-based budget. And this is a budget process that will align the city expenses with the goals of the council and the communities. So with that, I'll close out, and I'm happy to answer any questions that I can. And I'm happy to connect with folks afterwards in case there's follow-up. So open to questions. Thank you so much.
Thank you so much, Paloma. Thank you for your leadership and also for Councilwoman Edwards' leadership. You guys are doing a lot of great things. I'm excited to see what you're going to be able to accomplish in Riverside. And then with that said, so a lot of our viewers are small business owners and they are going through that, reopening stage. What would you recommend to our business owners as best reopening kind of strategies?
I would think that encouraging folks to be wary of the mask wearing, though it is in order. Go with ensuring that those best practices are being followed. And for restaurants in particular, I'm happy to pass along that permit information and connect them with those resources, because as of right now, for certain restaurants, for example, as the permitting in what I mentioned before, and the ability for folks to be able to get outdoor seating, following those best practices, I think would be best right now, as well as connecting with the Small Business Development Center and reaching out to our finance department as well for any questions, and definitely keeping an open line of communication with us in the ward. We want to be aware of what the issues that folks are facing right now, so that we can pass that along to staff. And we just want to emphasize that that open line of communication. So I'm sorry that doesn't speak so much to strategy, but the more information we get, we'll definitely pass along to you all as well to disseminate to those in your membership.
I think that's perfect, because as part of the strategy, it's to be informed, right? So I think that the best way to go, we could probably go on the city's website. A lot of the resources that you're talking about, the grant program, I'm sure is online as well. Is that correct?
Yeah, it is. And I'm glad to send that link in the chat if that's a capability that's available through this app. But I'm happy to link you all to that application, and as well as put out my contact information and Erin's contact information should anybody have any questions about that.
That would be perfect. I think that would be extremely helpful, because being informed is a big thing. And I think that you guys are doing a lot of great things. And the more resources that our business owners or our community is able to take advantage, the better.
Yeah, I'm glad to pass along any of those resources.
Perfect. Well, we really appreciate your time, Paloma. We're sad that Councilwoman Edwards wasn't able to attend, but we're glad to have you, and it was very informative. So thank you so much for everything.
Thank you all for having us, and she definitely looks forward to being here with you all in the future, and definitely grateful for the opportunity to share more information with you all. And I'll put my contact information in the chat so we can all connect later down the line.
Perfect. Thank you so much, Paloma.
Take care. Thank you.
Okay, so moving forward, we are going to go to our membership spotlight, and I would like to introduce our co-secretary, Ms. Elisa Cortez, who's going to be introducing our member spotlight for today.
Good morning, everyone. We are so honored to have Ms. Acosta. She is the Experience and Operations Director at HC2 Strategies. She has worked in healthcare for many years, partnering with hospitals, health plans, public health, elected leaders, business, faith-based, and community-based organizations. She provides leadership to various community-based activities that tend to be focused on improving the quality of life for Inland Empire residents. She has extensive knowledge and experience with innovative alternatives to traditional healthcare by using a collaborative and community-based approach. So they have community benefits and community health that need assessment, and they create these community health plans. Currently in her role as director, she oversees the day-to-day operations. They plan, develop, implement innovations that will bridge the gap in the care continuum across the healthcare systems. Ms. Acosta is fluent in Spanish. She earned her bachelor's degree in business administration. She earned a master's in public health from Loma Linda University with a focus in policy and leadership. She has been involved in leadership programs with the Inland Empire Economic Partnership and Healthcare Executives of Southern California. So good morning to you as well, Ms. Acosta. Welcome.
Thank you. Good morning, all. Thank you for the opportunity to present and share a little bit about what we do and my passion. Ever since I started working in this space about 10 years ago now, this October, I was kind of thinking back on it. It's never felt like work, but rather an extension of my passions and a sector that quite honestly I never knew existed before. So I think it's actually really nice the way this session worked out following Paloma. As Elisa said, my background, my master's is in public health, right? And so that's exactly what we're dealing with right now. And especially how does it affect, I mean, really public health affects everything. It's where we live, where we play, where we work, where we worship, all of that. And so it's really interesting. So I'm going to share a presentation with you. I'm going to try and keep it high level, perhaps towards the end, go a little bit into a specific, share a specific strategies reports that Elisa mentioned, just to give you an idea of something specific and tangible rather than high level. But overall, my goal is to provide you a context of the workspace that we're in. So I am sharing my slides now. Okay, I think this should be fine. Can you guys see it?
Not yet.
Okay. Perhaps someone can share it for me. I forgot his name. Sorry. It's not allowing me. I'm getting. Well, there you go. Thank you.
There we go.
So if we could go on to the next slide. So Elisa already had a slide on it, but essentially we are a strategy consulting company that we work with health systems. So that includes, when we say health system, it's, for example, Providence, right? It's a large system that has many hospitals throughout different counties and states. So Providence has some in Hawaii and Montana, Washington, Oregon, etc. Hospitals, physician groups, community, and other nonprofit organizations, such as like housing developers and things like that across the country. We essentially want to connect and transform the health and well-being of the communities that they serve by integrating the clinical, so the hospital kind of stuff, into the social aspects of the community to overall improve the equity and reduce health disparity. So at a high level, the services that we offered are strategy and innovation, community and organizational development, and financial and operational excellence. So this company we were established in 2015 by a co-founder. She is Dora Brilla. She has her doctorate in public health, and essentially the way she describes her role is she is a doctor of a community. Rather than an MD being an individual, she's a doctor of a community, and looking at indicators. What are those indicators that tell the story of a community that, if you address it, will help reduce the health disparities and increase people's life expectancy. Her co-founder, Rick Rawson, he is by training, he was a CFO, moved into the CEO position, and has been CEO for most of his career now. And so he was CEO for the hospital Marietta, Loma Linda University Marietta, up in Central Valley, and currently he is CEO for Right Out, an Adventist Health Hospital. So together, again, it was a really great combination because Doris saw it from a community level, Rick sees it from a hospital system, and together is, Dora always describes whatever issues are going on in the emergency room, it's a microcosm of what's going out in the community. So if we can address those issues in the ER, we can really help address what's going on in the community. So next slide, please. Here is our transformation process. We really believe in this U. I don't know if any of you have read the book Theory U, but essentially that's where this graphic is edited from. Here's the current state. On the left-hand side, you have the current state, and you're going to go through this various phases, right? You're going to have your eyes open. You're going to have conversations, essentially. So you'll let go. You'll come into a deeper learning to eventually allow the letting come for that future state. And so our role is really, when we walk clients, is through this bridging the current state to where the future state that you want to be. So although we do have some strategies that are universal, right? There's toolkits that are kind of similar for all. Every time we meet with a client, the process that we go to is very unique for them. Next slide, please. So in our sector, one of the things that is really important is shifting the paradigm, right? It's shifting the thinking. So in healthcare, a lot of it is like, oh, let's just do charity care, right, to help people. But rather in our space, what we're trying to do is unmanaged charity care and turn that into strategies for community health improvement. And then what that means is the community health needs assessments directly tying it into strategy. So what a community health needs assessment, if anyone of you may or may not know, essentially in 2010, after the passage of the Affordable Care Act, all not-for-profit hospitals had to conduct what's called a community health needs assessment, followed by an implementation plan. The community health needs assessment, I like to describe it as a report of telling a story of the community through two types of data. One is all the indicators. It's that qualitative data. It's the housing data that Paloma was referencing. It's the business. It's what are the chronic conditions in the community that people are dying of. And then what are the food insecurity. That also says a lot. Paloma brought it up. It's where are the food deserts in the community? Because if people don't have access to food, guess what? They're not going to be healthy. If people don't have transportation or feel safe in their home, guess what? They're not going to go out and exercise, right? And so all these things make up how healthy or unhealthy you're going to live. Anyways, and then the second part of this report is what we call voices of the community. And it's really qualitative data that is gathered that I conducted by going out and talking to community members, so conducting focus groups, going on and speaking to key leaders, such as everyone here at the table would have been a key informant, or hospital executives, 211 and sector executives, really looking at all the sectors of people who are in a position to really influence, to say, hey, what do you see are the needs of the community from all sectors, so that when our analyst analyzes this data, they can really get into the weeds and say, you know what, based on these two sets of data, here are the needs that rise to the top. Here's what the hospital, can address. And then that's actually what the implementation plan is. It's saying that from the hospital's perspective, we can't do everything as much as hospitals want to. And people may believe hospitals have limitation, either by their physicians, nurses, bed capacity, financial status, abilities, also whether or not they have the relationships to actually make. And at times it may not serve them to take the lead, for example, on housing and homelessness. The hospital can't really do anything there. However, they can support initiatives, go to the table, present at meetings to say, you know what, from a health standpoint, here's why housing is important. Here's why addressing homelessness is important. So that's what we do, really connecting it to the hospital strategy in order to see a greater impact. And then integrating care to address socially complex issue at the neighborhood level. So really looking at upstreams. What are those issues that are translating into health, but really are at a social level? So an example I like to give is diabetes, right? A patient comes in Actually, I'll give a different example. There was this doctor. I don't know if any of you guys have heard him, Rishi Manchanda. He does have a YouTube. It's awesome. He's an MD, a primary care doctor. And essentially, there was this patient. She kept on coming in, coming in. She had her asthma was just not going away. She was low income, doesn't get time off work. So every time she missed work to go to the appointment, she was losing out on money. She was so frustrated. She saw him. Anyways, he started asking some deeper questions, not just from health, like where do you live and what are you eating, things like that. Anyways, it boiled down to there was mold in her home. And without addressing the mold in her home, her asthma was never going to get better. So what he did was he referred her to a attorney. The attorney helped her write a letter to give to her landlord so that the landlord took care of the mold without retaliation. Once the mold was removed, her health significantly declined. So those are the complex issues that I think so often of us, we forget that they're interconnected. Again, another example, diabetes. A patient comes in, people think they're not really following through, but if a patient doesn't have transportation to get their medicine, guess what? They're not going to take it and their insulin's going to go low. Or they don't feel safe in walking in their neighborhood. They're not going to go out and walk because there's dogs around, because there's no street lights or sidewalks. So there's all these other reasons why they're not doing what they need to do. For most of them, there are some that are just non-compliant, and that's just something that we deal with. And then lastly is really changing that, engaging communities into transformative partnerships with shared accountability. Everyone has a role to play with this, but we all must also be held responsible. Next slide, please. So I see a question and I will address it after the fact. So thank you. So one of the things I wanted to point out, in healthcare, we spend a lot of money on these chronic conditions here, diabetes, coronary heart disease. This was from 2003 to 2018. So that's the time frame. Asthma, depression. Some of these are lifestyle changes that really can address, but as a nation, we spend a lot of our income on this. Next slide. What I want to point here is that here, if you notice, you have, so in this space that we work with, there's access to healthcare is only a small percentage of someone's actual health. And what that means is if you notice these determinants on the left-hand side of the bar, 10% of it actually influences how healthy you are. But if you look at how much we're spending on it, it's 88%. That's a huge chunk of money. And really, if it's only 10%, we're not using these. So we really got to look at innovative solutions, innovative partnerships, look at those non-traditional roles, because I think it's very easy for us to get siloed in our industry and not look or want to just keep everything insular. The other thing I want to point out, right? Genetics influence 20%. Our built environment is another 20%, in our behaviors is another percent. So again, it's just really we're spending a lot on access to healthcare, but it's only part of the overall health challenge. Next slide, please. Again, here in the US, this slide is interesting because we are spending a lot on healthcare, but very little in social spending. So if we helped address some of these social issues, housing, transportation, economics, right? I mean, there's some things that are just limited, but if we did that, then we would see other states are spending more on social spending and their healthcare spending is much lower. So there is this relationship to the way income is spent, the GDP. And again, this is all in percentages GDP. Next slide, please. This is the slide that I was talking about. So this particular slide is from the Robert Wood Johnson Foundation. And essentially, so on the left, policies and programs are the overall sustaining factors, right? That's the framework for which, as a society, we function in. That influence the health factors, right? What are the redlining rules that were established a long time ago where certain people couldn't purchase homes and then ultimately leads to health outcomes? On the right-hand side, you'll notice that the percentages are attributable to how much it influences our health. So starting from the bottom, physical environment, right? It's only 10% of our health, but it's indicators such as air and water quality, right? Housing and transportation. The social and economic factors play a huge part, which is 40%. And really, that's our education. As we know, the more education you have, the more money you're going to earn over your lifetime, right? So if you have a bachelor's over high school, more money. If you have a high school over nothing, more money, just because of the opportunities that you have. Are you employed or not? Does your employer offer you the opportunity for health insurance? Income, what is your income? The family and social support and the community safety. Above that, we have the clinical care. And again, this is the access to care, healthcare, right? Can you call, one, do you have insurance? Do you know how to use your insurance? Do you know where to go? The urgent care versus emergency room, and for what types of services, the quality of care. Sometimes it's not enough just to have access to this, because your appointment might be a month out when you need it right now, or the information that you get isn't in your language or doesn't make sense from a cultural standpoint, right? The way as Mexicans or the Latino community, we do healthcare very differently than perhaps our Caucasian brothers and sisters, right? There's just things that the way we look at, or we tend to go at the very end instead of addressing some of these preventive issues early on. And then health behaviors, right? Are you using tobacco? What's your diet and exercise like? What's your alcohol and drug activity? What's your sexual activity? Are you being safe in all these issues? And essentially it's, leads to the length of time and the quality of life. So although we do spend a lot of money on access to healthcare, it's a very small portion of this. Next slide, please. And feel free to click until the other three. So essentially in our space here as it is, right? There's a car driving, it crashes. Well, instead, so it crashes, right? And so they build a hospital for your trauma. They build a hospital for your care, and just hospitals are built. Going upstream would be looking at, hey, why don't we fix the curb right there? Maybe put a sign up that says, hey, don't, slow down so you're not falling. So really looking at what are those upstream interventions that are sometimes even low-hanging fruit. Again, if someone was to put a sign there wouldn't be a need for all these hospitals. Or how to educate, don't be driving so fast. Sometimes these are very easy interventions that we think are known to all, but the reality is that they're not. Next slide, please. And here's what I wanted to address. So although I did spend some time early in the presentation, how it trickles down. So I shared the high level, how it trickles down is the CHNA identified needs. Over the last 2.5 years, I worked with 7 different entities. So a couple here in Riverside and San Bernardino County. I worked with 7 different hospitals. I worked with San Gorgonio Memorial Hospital, Tillamook, which is out in Oregon, St. Helena and Sonora, which is up in Northern California, Central Valley, so the 4 counties there, Madera, Kings, Tulare, and Fresno, and LA with White Memorial. And essentially going through this process, this is the framework that we use, right? So all of those 3 systems that I just talked to you are interconnected. You can't isolate one, or else you're not really addressing all of the issues. So that's the lens when we do our reports, that we looked at those indicators. And I can tell you that based on every CHNA, the needs on the left-hand side were all needs that were identified in some fashion or another. The hospitals had the opportunity to rank them, again, based on their need of how they could actually address them. But there were all these, it was housing, it was homelessness, it was behavioral health, substance abuse, right? Chronic conditions, asthma, obesity, and for some communities like San Gorgonio and Sonora, senior care, you have a lot more elderly there. And so the interventions that you would do for an elderly are very different than ones that you would do for a mother and a newborn child, for example. Next slide. And then again, trickling down even further, COVID at the current moment has changed the landscape in which we do everything, right? Our physical, mental, and economic well-being. So all these indicators and all these areas that I've been sharing with you, they've all been impacted in some fashion or another. And right now, there's always been health disparities, and even more so now with COVID, it's bringing it to light, right? So it's looking at it, how do we actually address it? Public health threat is not going to go away. And so looking at it from a hospital standpoint, what what is our role? And we believe it's really approaching it through partnership, holding ourselves accountable, using the right metrics. And that's where we help our clients is what are those right metrics? What are those best practices that are suited for you based on what your strengths and where your region is at? And if there's someone that's taking lead, then let them lead it and you come and support. And if there's others where you need to take lead, then that's where your best fit is. So I think the next slide is the last one. So I will stop there. I know I said a lot. I tried to be as concise and informative, but definitely there's probably questions.
Yeah, it was absolutely very informative. We do have a question here in the Q&A. Someone said the hospital profits from ER and admissions. Why would they support initiatives that reduce those sources of revenue?
So speaking, I've done very little work with for-profit, so I'm not going to speak at it from that lens. From a nonprofit standpoint, the hospital, I don't know that I would call it profit, but because there is a lot of sometimes charity care, all nonprofit hospitals must conduct what's called community benefits. And essentially, it's providing services that are available to all community members, not just their patients. And so so that's one thing. In terms of the money as a nonprofit, it's not really going into their pockets per se. It's, they have to reinvest it back into the community. So from that standpoint, and that's really where we're trying to do is have them really strategically, what are those needs going on in your emergency room that can be translated into community interventions because they are losing on it. So from a hospital standpoint, there are certain codes that if you go in, you're admitted for that, you're discharged, and you come back within 30 days, they actually get a really high penalty, so it doesn't serve them. And in the ER, they have what's called the frequent flyers, and sometimes there's certain individuals that just come in over and over for the same thing that are costing the hospital a lot of money rather than, as someone said, profiting from it. So at Loma Linda, for example, one of the organizations that I used to work for, what we did is we had a nurse work with the ER group to say, okay, what are the areas here? What are the people coming in from, right? Like they had certain codes, and those really high, the frequent flyers, if you will, they said, okay, here's the intervention, a whole continuum of care, right? So education, they would follow up with them to ensure that they had their medication. They would educate them on how to do, and it was like a 6-week program, and it was optional. So really to try to educate these. Another intervention was, where are the hotspots, right? So you have this data. Where are those buckets using GIS technology to identify the areas where people are actually are really sick from, and what's the why there, and what are the resources that can be used. So from a not for profit, no, it does not behoove them to benefit and not address these issues. And because as a not-profit, most of them are faith-based, there is a reason for Loma Linda and some of the Adventist Health. They've been in here for over 100 years. Providence St. Joseph's Health, same thing. They actually have a reason to do this. It's in their DNA to address the issues and care for people. So I hope that answered your question.
Yeah, I think that's a great answer too. That these hospitals are part and parcel there to help the community in any way they can. So why not engage in things that'll help reduce harm overall? Thank you so much.
Thank you. I want to add something else. For example, as well, Kaiser, they have this model where they do anchor institution, right? And they call them anchor institutions because these are organizations that are in the community for the long run, right? Then have been. They're not going to easily up and leave with everything. And so they've really started looking at how is it that we can support our community and help it thrive, not just from a healthcare standpoint, but for example, from a business, right? Can we outsource our washing, right, more locally? Can we buy our produce for our food more locally? So again, really looking at it from an innovative sense, not just from a healthcare sense, but using their purchasing power to reinvest into the community.
Which is absolutely excellent. Like, I love that. Again, that's such a great way to help grow yourself and others at the same time. So I like to see that a lot of different places are utilizing that. And thank you so much for coming today.
Yeah,
and
thank you.
your business with these great initiatives that are really helping the community.
Thank you.
And then Laura, we have your information on the screen. So what's the best way to get in contact with you if any of our viewers had questions?
Yeah, if you want to, let me give you my cell phone and my email. To be honest, those are the two big, my cell phone has become my work phone now as well, because working from home, sometimes I'm out. So that number, actually, how about I put it in the chat? Would that be more helpful? What's the easiest?
That would be perfect. Yes, that way our viewers can get the information.
Yes.
Okay, perfect. Thank you so much, Laura. We really appreciate it. And thank you for being part of our Cafecito Wednesday. Next, we are going to be providing some legal updates. I'm going to invite our board member, Sal Ayala, and myself. I know we've spoken about some of the local legal updates between Paloma and Laura. We just want to make sure that everybody is on the same page. So to start it off, we're going to be talking about Governor Newsom's order for the face masks. So Memo, can I have the next slide, please? So Governor Newsom, as you guys know, issued an order that all Californians must wear a protective face covering in public spaces. Now, there are some exceptions to that. Make sure that you visit the California Department of Public Health in order to see those exceptions. Some of them is if you have a child that's 2 years or younger, they're not required to wear a face mask because of fear of like suffocation. If you're at a restaurant, as long as you're with household members and you're practicing your 6 feet social distancing, you're allowed to take off your mask to eat and to drink. Outdoor work or recreation, same thing. If you're by yourself or with your household members and you're maintaining a 6-foot social distancing, you're able to take that mask off. But in order to make sure that you are on top of everything, I would recommend that you either visit our website, which has the resources, or the California Department of Public Health. I'm going to touch upon the PPP loan forgiveness application very briefly. A lot of us are familiar with the PPP loan. A lot of businesses have obtained the PPP loan. However, it's getting to the point where now they extended it from 8 weeks to be able to use to 24 weeks to be able to use. We want to make sure that all of our viewers, all of our business owners that did receive the loan know that the lender is not going to automatically forgive that loan. You need to apply for the forgiveness, and it has to be through your lender. The SBA has already put out the application. It's a little intricate. If you need any assistance, please reach out to the chamber, and we're going to be more than happy to help you walk through that. And if you know anybody that did receive the PPP loan, just remind them. Make sure that you're applying for forgiveness to your lender so that it's 100% forgivable. Last week, Brian Sahagan was talking about SB 939. It actually failed to pass in the committee in Sacramento, which is in regards to evictions and a moratorium on evictions. However, just because it didn't pass on a state level, please keep in consideration your county and your city. Paloma was talking about the one in place for Riverside. There's one in place in San Diego. Los Angeles just passed some funding to extend. So make sure that you, just because the state didn't pass it, you're keeping track of your local, especially on the city and the county websites. Now, with the reopening best practices and strategies, I'm going to pass it over to Sal. We want to make sure that you as a business owner, as a community member, you feel safe going to locations, and if it is a business owner, safe to reopen. So if you have any issues or topics that you want us to speak upon, please let us know. But Sal, as a business owner, I know your sister is a business owner. She has a hair salon. Can you talk about some of the best practices and strategies that you can give to our viewers as we start going into phase 3, and now we're in phase 2.5, if we can call it?
Absolutely. So we've thank you everybody for joining. My name is Sal Ayala, also a Munico Biz, as well as a board member, and I also help manage my sister's beauty salon. You know, some of the challenges that we've been dealing with, and some of the things that we've implemented in the salon, for example, is obviously we don't allow anybody to come into the salon without a face mask first and foremost. Before they even enter into the salon, we take their temperature before they come in. They go straight to their chair. We're actually in the process of closing it today until Monday to implement some additional safety precautions, such as dividing every station so that there isn't any interaction between customers and stations. And also we have a limited staff, right? So instead of having, the usual 8 to 9 stylists, we only have, or barbers, we only have 3 to 4 that are coming in to the salon. So, we're doing everything we possibly can. Unfortunately, you can't avoid the interaction that happens outside the salon, which is kind of the scary part for all of us in any business in reality. So in addition to all of that, we also are, we don't let the clients come into the shop. We have them stay and wait in their car until it's their turn to get their hair done. Then we text them so that they can come in, or we call them so that they can come into the salon. Everybody obviously in the salon is wearing face masks, and we just ordered shields as well for our hairstylists, because it's a very, very, close contact with clients, obviously, in that environment. So we've taken those precautions, gloves as well. But yeah, it's very scary, and it's a difficult situation because you want to be as precautious and to a fault of everybody's safety, because it's going to prevent us from opening if we're not. It's going to prevent us from making money, and ultimately it's a financial decision it's a business decision that has to be made. Do you want to take the liability of opening up and contaminating somebody through your business and then being liable for it, right? Obviously, I've consulted with Carmen as well and Brian as well. And it's a catch-22. You need to open up because you need to, put food on the table for your family. But at the same time, is that going to be counterproductive in the long term, where you can't even reopen because you're being sued or because of some other issues that may arise from it, or simply your employees getting infected and can't come into work and do the job. We also have a business in Guadalajara, Mexico, and everybody's still working from home. They opened up 2 weeks ago, and we were supposed to open up, going back to the office this week, but same thing, we decided not to. We're able to go back. We have all the precautions in place in the office, but we decided not to, simply because we felt it wasn't worth the risk, especially when we're able to work from home, able to work remotely. We're taking that extra precaution and letting this new wave that's coming go away before we actually get back into the office and put our employees at risk, because our employees are really our family. We spend more time with them than we do our own family. And I don't really call them employees, I call them associates. So our associates are very important to us. So we want to make sure that their safety is our highest concern. But in general, in public, we like we've been saying it over and over again, we're all in this together, and we can't forget that. It's a little uncomfort to have a face mask and to do the extra things, but especially in public places, we need to exercise that, every single time, so that we can continue to open up shops and keep business going, because obviously that's how we survive. We can't survive without having our businesses open.
Thank you, Sal. And I think, Sal, that it's important that we've learned to use the internet. We've learned to use Zoom meetings, Ring Central meetings.
Absolutely.
So we have alternatives as well. So some of us that don't have to deal per se with customers, if I wanted to meet with a client or a prospective client, now we have different resources that we can continue using. I think Laura had told me that they work from home, and that's a choice that they had made a while ago. So it wasn't something recent, and it's worked for her business. So there's a lot of alternatives for people that don't feel comfortable yet, like you were saying, opening 100%, but using all the technology and all the resources out there to be able to continue doing their business, right? And that's what your business focuses on as well.
Correct. Yes. So we're obviously a digital marketing business, and we help businesses leverage technology so that they're able to, one, work from home, and two, market themselves online and do as much as they possibly can, especially in this environment, remotely, and utilizing all the technical resources. But yes, absolutely. But primarily, whenever possible, and avoiding contact and avoiding public places, for your business, it's better that you try to continue to work remotely and keep everybody safe until, let those other businesses that are definitely, like the beauty salons that have to open, that, that have to have people come in. You can't avoid that. Let that risk. Why add additional risk when we don't have to? What I'm seeing.
Perfect. Thank you, Sal. And I think we appreciate it coming from a business owner and a different perspective. We want to make sure that our viewers and our business owners are staying safe, and that they're reopening so that they can continue to reopen. And hopefully we don't reach that threshold that Paloma was talking about, where we reopen, but we are not practicing social distancing, not wearing our face masks, and then we're just going to regress, right? So we want to progress and be able to be safe at the same time. So thank you, Sal, for that. Next, we are going to go to our...
Carmen, there is a quick question, I think, for you in the Q&A. Someone's asking, if we have a factory in Mexico that opened because we pressure them to begin operations, can we be liable?
Okay, so I don't practice law in Mexico, just in the United States, but I can say, just based on my knowledge, it's going to depend on what part of Mexico, because different parts of Mexico, like for example, Sal was saying Guadalajara, it's different than Mexico City. So it's really going to depend what that area, what that state is going through, what phase they're in. And if you're not in that area where you're allowed to open the factory and you're pressuring them into going into the factory, then I believe you could get into legal issues. What I would recommend doing is looking at your state or the state where that factory is in and see what the government is recommending. And like Guadalajara, are they ready to reopen, not ready to reopen? Because you don't want to put people in position where if you haven't made sure that the factory is sanitized, that it's safe for your workers to go back to the factory, giving them the precautionary measures. If they don't have face masks, are you providing it for them? All these different issues that come into play. So just keep that in mind when you're thinking about the factory. Thank you, Elisa, for the question. And next, I would like to welcome our Executive Director, Joe Ramos. He's going to be providing us not just with our GRHCC chamber updates, but with our partner updates. Welcome, Joe.
Good morning, everybody. Thank you, Carmen. Sorry about that, guys. Good morning to you. Laura, Paloma, thank you very much for being on here. Really appreciate your time. Great information. A couple of updates from the GRHCC. We touched on a few of them last week, but we do have a few more points to bring up. Our annual scholarship application deadline is going to be June 30th, so that's less than a week away. That's next Tuesday. Please, if you don't yourself have any children or anything that might benefit from it, or if you have any family or friends, you can go to grhcc.com/application, or I'm sorry, /scholarship. That'll be a direct link to the application. We give away $1,000 per student. Also laptops, printers, gift cards to Office Depot, everything that helps a student kind of package up and be ready for the next phase in their education. So we really want to promote that, get in as many applications as we can and kind of help out as many people as possible. And if I can get the next slide, please. And those scholarships are actually funded by our annual golf tournament. We're excited to announce that we finally have a location and a date that is set. It's going to be August 14th at Dos Lagos in Corona. This is actually the first time we're going to be able to put out this marketing material right here. So we're really excited about that. It's going to be a really fun event. We have a great time every year. All the money raised goes directly to our scholarship program. There's some of these sponsor packages right there. All this information is going to be posted on our website, on our social media. So as time goes on and as we get more information, more sponsors, we'll be making regular announcement updates. The programs, the whole sponsor you can expect to see, because we really try to create fun environments where every hole you're going, you're getting a new experience, you're seeing a new business, you're getting new interactions. So again, please follow us on our social media to make sure you get updates on that. Next slide, please. And this is really a big one, guys. This is really important. As Carmen mentioned earlier today, with Gavin Newsom's mandate that Californians have to wear face masks, the GRHCC is in a great position to be able to offer masks to our membership. We offer one box per guest or per member. It is on a first come, first served basis. We want to make sure that we get these members or get our members and get these masks out there. Again, it's not an option anymore. It is mandated. So we want to make sure that we provide any kind of resources we can. This is really a big one. It is a limited supply, so feel free to reach out to me. My number is right there on the screen right now, or through any of our channels, any of our contacts on grhcc.com. And we really want to make sure that we provide safety so that way our members can reopen their businesses in a safe manner and not face any kind of future shutdowns like that. And I think with that, that's going to wrap up our chamber updates from the GRHCC site.
Thank you so much, Joe. And then, Joe, just to let everybody know, it is one box of 50 masks. So you can reach out to Joe and let him know if your business needs it. If you run out after we give you the first box, we can give you a second box. This is really a resource that we were able to get through the county because they want our businesses to thrive and want them to be safe. So they are giving us the opportunity to make sure that if you don't have the resources for the masks, because I know given COVID, it puts an additional financial burden on a lot of owners, whether it's maintaining a clean environment, the sanitizer, the face mask. It is an additional financial hardship to be putting on the business owner. So we would like to help. And just briefly on the golf tournament, if you don't golf, but you still want to be supportive, come out, volunteer, come to our luncheon portion of it, just come to the whole. You don't have to golf to be part of it, but it's really, really great for our students. And given everything that's happened with the class of 2020 graduates, and then, just everything in general, I think that our students would really benefit from that laptop, from that printer, given that a lot of classes are online as well. So please make sure that you support us in that aspect. And you can reach us in all these social medias at thegrhcc.com. We have an IG, we have a Facebook, we have a YouTube channel. If somebody missed one of our Cafecito Wednesdays and wants to see it, please feel free to let them know that they are available on YouTube and on our website as well.
And just to follow up really quick, Carmen, I really want to encourage our memberships and anybody viewing to follow our Facebook channel in particular. We try to update that multiple times per day with new grant programs, new educational opportunities, not only just for the city of Riverside County, we also look into San Bernardino County for our neighbors and get as much information every day as we can out there. So please, be sure to follow us on that.
Perfect. And I don't see any other questions to be answered, but I just want to remind everybody, we do our Cafecito Wednesdays every Wednesday at 10 a.m. We always highlight one of our new members or a member. We always try to bring someone from the community that can provide information. If there is anything or a subject that you would like the GRHCC to discuss or have any recommendations, please feel free to either email us at our website, invite others to attend as well. We like to get the word out. It's free. You don't have to be a member. We want to make sure, like Laura and like Paloma and everybody has been saying, we want to be there for our community. It's not just to be there for small business owners, but our community in general. And the presentations that we had today, Laura and Paloma, thank you so much. They were incredible and very informative. So with that said, today's Cafecito Wednesday is over. We will see you next week, same time. Thank you, everybody. Have a good one.
Thank you, guys. Have a great day.
Bye.
Bye, everyone. Take care.